I'm talking to Dr. Saad Usmani, a hematologist-oncologist at Memorial Sloan Kettering Cancer Center in New York. My first question for you, Dr. Usmani, is what drove you to practice in the field of multiple myeloma?
My interest in multiple myeloma started when I was a fellow in training in Connecticut, and I was in the clinic as a fellow and saw myeloma patients. And at that time, we did not have many options for these patients. And I also heard about the role of the immune system in the progression of this disease from precursor state to active state. And that led me to working in a immunology lab focused on multiple myeloma and seeing more myeloma patients in clinic, and eventually led to my first job as an assistant professor at the Myeloma Institute in Arkansas.
Fascinating. And how did you become involved with the International Myeloma Foundation?
When I joined the Arkansas program as faculty, my mentor, Dr. Barlogi, was very much involved with the International Myeloma Working Group. I believe he was one of the founding members of that effort, along with Dr. Dury. And he got me involved in all the wonderful work that cohesive group of investigators was doing. And I've been a part of that effort ever since.
Excellent. And you're participating in our Iceland cycling expedition, which is along with 11 other cyclists who will all be cycling across Iceland to raise funds for the International Myeloma Foundation and myeloma research. So what motivated you to participate in this cycling expedition, which promises to be across some challenging terrain in Iceland?
I'm really looking forward to it. So it was actually several years ago that one of my myeloma patients encouraged me to become part of an endurance event and do fundraising for myeloma research. I think part of this was also a little selfish in trying to find some time for my own mental and physical health and do it for a good cause. So I started to, do treks and, running and, running marathons to raise money for myeloma and cancer research. And when I heard about the Iceland expedition, I think that aligned very well with what I wanted to do. As a myeloma clinician and researcher, you always think about what more can I do to contribute to the field. And this was a natural fit. And several, colleagues and patients, who are engaged in this effort for many years, are part of this expedition. So I'm really looking forward to participating and looking forward to contributing to all the wonderful work that IMF does on the research end.
Because this kind of leads into my next question. You mentioned you already have done some marathons and some other types of training. How are you training and making lifestyle adjustments for this particular cycling tour?
So I've started to incorporate cycling in part of as part of my routine. I think from a cardiovascular health standpoint, I'm not so worried. I think it will be fun to do this, and the weather will be cooler, so it's that's always welcome whenever you're trying to do an outdoor activity. Rather than me doing it in the warm weather. I think the bigger challenge for me is adjusting to sit on the bicycle for a prolonged period of time. And so it's just getting used to that bicycle seat, and that's what I'm trying to do.
Yes, I hear some cyclists call it the saddle.
Yes.
Sitting in the saddle.
Sitting in the saddle and just trying to, stay in the saddle.
Exactly.
And be comfortable with being, sorry about, cutting you in, but
no worries.
Learn to be comfortable with being uncomfortable.
Exactly. And which was what patients have to do so often. So I don't know if you've thought about it. Once you actually finish this cycling expedition, what are you planning to celebrate your accomplishments when you get back? Anything at all, or just?
Not really. I think if I'm successful in doing this cycling event, then I'll likely do more. I'm slated to run the Chicago and New York marathons later this year. So once, the Chicago Marathon is in October, so it's a month after, this cycling event.
Wow.
And then the New York Marathon is the first weekend in November. So I won't have a lot of time to celebrate. I'll just have to get back into the training routine for running. But then, next year and subsequent years, if there are more cycling events that the IMF host, I would love to be part of those. I think you can see, two pictures behind me.
Mhm.
And so, in fact, if I, move this a little bit,
Yes.
so that picture where, I'm wearing the shades, that's my patient who me into running.
Oh, excellent.
And then the other patient in that picture, he was an ardent cyclist. He would cycle for so many different events. When he was going through his transplant, he had a stationary bike in his room, and he would actually
Wow.
bike. He was like a freak of nature.
Transplant is
So
not an
these
easy
people
procedure to
actually
do that
have-
after.
Yeah, so these people have motivated me to do, these events. And that last picture, I don't think you can see it that well, but that's me standing in front of Mount Everest, and the base camp is behind me.
Wow.
So that was the first trekking event that I did with one of my patients, going to the Mount Everest base camp, and we raised money for myeloma research.